You learned this probably the second day in hygiene school. Come on. This is an Explorer. This Explorer was perfected in 1880. 1880. Most of you are women, doctors who are not women, or the hygienists who are not women. You may want to close your eyes. Do you want your pap smear read on a microscope that was perfected in 1880? We need to step it up a little. What we're doing in diagnostics and in dentistry is shameful. We would never put up with this from a physician. We just never would. We need to be more aggressive in our diagnostics so that we can make an actual diagnosis and then treat on the basis of that diagnosis. A DO is not a diagnosis. 4 quads of SRP is not a diagnosis. That's a treatment. We need to have a diagnosis of a disease before we can go into treatment. And when we start talking about going into medical billing, you can't do a medical billing without having a diagnostic code first. You have to have a reason why you're doing something. I would encourage you not to be distracted by what we traditionally call a periodontal indicator. Pockets. What are pockets? Pockets are a surrogate marker. Pockets are a distraction. We need to be using something. We need to be upping our game a little bit. We need to use our advanced diagnostics. This is the Cavo pen diagonal with a perio tip, so that you can use it on to detect calculus underneath the gums. The blood testing in the office is much easier now. We've got Richard back there, and he's got some samples back there that we can open one, right, and look at it and see what all the components are. You don't need a special certification. There's free shipping. It's customized to the patient. You only want to do whatever the lab things we want to do. The tests are accurate and convenient, easy to use. This is a picture of what they look like. The whole thing comes in one little package, and it's super easy. I've got one more video.
Each dentist has a requisition form for each patient to examine and blood collection, just like this one. In each kit comes all of the pieces necessary to perform the blood collection. You've got a Band-Aid, colostrum, alcohol prep, lead set, blood sample return bag, in which remains a desiccant in order to provide a sample on the way back to the laboratory. Collection medium, which is a real probe like collection card, and return bag. Okay, now what I've done is, as you see, I've filled out the patient information on the requisition form, but I've also taken one of the labels off the top of the requisition and I've placed it on the collection card in the appropriate spot here. That now mirrors the card to the requisition form. To be on the safe side, I've also written the name of the patient on the card. It's very important to write that on every patient. Now I'd like to actually do the collection process with David's agreed to be our patient and administration today. And first thing I want to check to make sure that his fingers, his hands, and his warm. It's hard. It's very hard to get a good blood sample with cold hands. So if you take the alcohol prep, wipe the finger, let it air dry for about 30 seconds. Twist the tip off the hand set. Lift the finger, wipe off the first drop of blood, and simply apply the drops. This you think about anywhere from 3 to 5 drops of blood, depending on how large the drops are. You get 3, 4, so 5 you can measure. Put the gauze pad on the finger, hold it in. And that's Band-Aid. Put that on the finger. That's all there is to it. We're going to let the sample dry for about 15 minutes. And you'll see, you can get the camera down close to it. You see that the end of the red cells here is a yellowish liquid. That's the serum being separated from the red cells. This will migrate for a period of time yet. And the serum is what we actually do the test off of. Again, we'd like it to dry about 15 minutes for the sake of our demonstration. I'm not going to take that long. All we have to do when it has dried 15 minutes is tear the top off of our blood sample. Turn that, open it up, take the collection card, slide it inside, tear the bottom part of the requisition form off. That's the dentist receipt. The number of the specimen is pre-printed on there so it matches up to the labels that are on top. The dentist can fill this out, put it in the file, do whatever he or she wants with that. This has to come back to the laboratory. We fold it in on itself, put the blood sample with it, slide it into our return mailer, seal it, put it in the nearest post office. That's all there is.
Presto. Who did not have to do that as part of their formal education? Really? You didn't have to do a finger stick in some kind of class? Wow. All right. Well, then you'll have to spend an extra 3 minutes learning how to do it. It's very, very simple. And it's got all the parts to it. This is kind of what the little collector looks like. Health Point is the company that makes it. New Line is the company that distributes it. And they have the lipid tests. And remember, the lipids are important because they stimulate the osteoclast. So we want to know what the lipid level is also, not just the C-reactive protein. And we want to know what the A1C number is so that we know that we're treating periodontal infection and not diabetes. Their experience in blood stability and transportation and self-collection brings the diagnostics closer to the patients and to the consumers. We also need to be more particular when we're doing our measurements with the pockets. We need to not use your standalone probe. Do you know that as the day progresses, you use more pressure with the probe? Did you know that? You didn't know that. Did you know that if you have any carpal tunnel issue at all, you apply more pressure? Does anybody know what 5 newtons is? That's how much pressure you're supposed to use. Anybody know how much pressure that is? Come on, somebody's got to know. You do it all day, every day. Look what she's hiding. The lady in the yellow. Not me. I don't know. Don't call on me. We don't know. We don't know what we're doing. And I tell you what, if the school calls and tells you your kid is truant, you use more pressure. You do. Come on, how late is it? This is the Florida probe. This used to be a huge system that would do all of the measurements for you, and it would talk back to you, and it would tell you 4, 3, whatever. It's an awesome system. I know a lot of hygienists that are using it and would never even go to work if it was broken. We still need to have those kind of readings to measure the progress or the lack of progress as time goes on. The newer components to the Florida probe, you have Florida probe information in your young bag, also includes a database to include the C-reactive protein numbers and your lipid numbers and all of that other kind of information that we never thought we'd have to use. So it includes all of that, and they now have a Go probe, which is extremely cool. You can still use your traditional perio probe, and then you know how those calculators, just a regular little calculator, you type it in as you're doing the readings, or you can have your patient type in their own numbers, and then using Bluetooth, it goes right to the computer, and you can still print it out. And it's not as comprehensive as the full version, but it makes it a little bit easier to take that step into better diagnostics and easier periodontal treatment. Antibiotics, remember in the 60s? Remember in the 80s and 90s we used to give everybody tetracycline? Remember why it didn't work? Tetracycline was the only drug that would go into the pocket, but it couldn't penetrate that biofilm, and that was a problem. Locally delivered antimicrobials are very helpful because they are a high enough concentration to penetrate into that biofilm. Now, last week I was with that biofilm researcher, and the research she did was on wound care. And what she did, and she and her team, is they used xylitol with lactoferrin, and they put it onto open wounds. One case she had was shrapnel wound that was 40 years old, an open wound for 40 years, a biofilm infection. And they cleared that up. What we're finding is that xylitol, can penetrate into the biofilm, and it breaks it apart. Xylitol also has some other really cool benefits on cell walls that we weren't really prepared to know. We thought it was just going to, screw around with strep mutans, aren't we happy? But what we're finding is effects on staph infections, not just strep infections, and that there's some other bacteria that it also affects that is getting to get a lot of play. You also have some information on Atrodox. Atrodox is back again. You don't have to refrigerate it, and you don't have to mix it 100 times. Yay! So, there are at least 46 different combinations of perio-pathogens and 10 different antibiotic regimens that might be required to specifically target them. Once we start stepping up into our periodontal diagnostic mode, we're going to start to look at these different bacteria and go, well, which ones are what antibiotic are we going to use for this kind of bacteria? The treatment of periodontal disease by periodontal therapy or surgery results in significant clinical improvement and systemic improvements. But we don't have really good long-term results, which is still a little disturbing. Increased awareness of the role of inflammation in systemic conditions is going to help. The most common chronic infection in the U.S. is periodontal disease. And when you talk to caryologists, you will also know that caries is the most chronic infection in the United States. Measured C-reactive proteins. This is a little study that they measured the C-reactive proteins 6 weeks after periotherapy in 35 patients. Sorry, I'm getting ahead of myself. And you can see the decrease here and there's a bunch of studies like this. I just sit here and just put one up here. CRP levels went down in the whole study group. The fibrinogen number also went down. Remember, that's the clotting factor. In the moderate periodontitis group, it also went down, both of those numbers. CRP went down 50% and 70% here in severe. So we've got there's other studies to show that periodontal treatment will decrease these measurements and these readings. Fibrinogen, as I said, is a clotting factor. And it should also be, well, not also be, but you're going to find that you're going to have other reasons to look at that fibrinogen number as well as the C-reactive protein numbers. So don't be distracted. Diagnosing periodontal disease is more than just pocket deaths. That's a historical marker. Try to keep that in mind. The DNA tests are easy. Vanna tests, Topaz are also two real easy chairside tests. And we can find new markers for management, including CRP, A1T, and SED rate. Use something like fluorescence technology. We've got a couple of different things now. This is up-close version of the Cabo. Debridement. Who's not using ultrasonics? Nobody's going to raise their hand. Good, smart audience. This was a study that was done by Dr. Driscoll a while ago. She repeated it in 2000. This is the root substance removed after 10 seconds of instrumentation. Ultrasonics removed 11 microns. Look here, the difference between a curette for 10 seconds and a diamond burr. It's almost identical. Okay? The ultrasonic energy does so much more than just remove biofilm. We have different tips now that we didn't used to have. This one up here, I don't even know what company, it doesn't matter. This is the implant tip. And it's just the movement. I was doing some other research on biofilm and ultrasonics. They're using ultrasonics to break up biofilm in the sinuses. They're using ultrasonics to break up biofilm in wound care. So this is up and coming, and it's very low. You don't need to have